SEKISUI Diagnostics is comprised of two different business units, in vitro diagnostics or IVD, and enzymes and biopharma services. Our IVD portfolio serves the core lab, as well as the physician office markets.
There are three primary lines in our diagnostics business unit. The first is in the core laboratory or centralized laboratory setting, and this is where high volume testing occurs in a central point. Our primary products are in clinical chemistry, and these are products such as glucose and hemoglobin A1C for diabetes management, also tests like HDL and LDL for cholesterol management. And the company has a market-leading position in a number of products in the clinical chemistry area. The second area in the core laboratory segment is coagulation, and this is an area where the doctor needs to understand the ability of a patient to heal after having an injury or surgery. Also, what happens when a patient has clotting issues that come up. So that encapsulates most of our core laboratory business. The second area that we have is in what we call point of care or near patient testing. And in this particular area, we are able to move the test closer to the patient. So rather than taking a few days or a day to get a result, we can get a result within 15 or 20 minutes in most cases. This is very important, as we saw during the recent COVID pandemic, where getting a quick result allows a doctor to then immediately treat a patient. And that's part of the reason why we believe wholeheartedly that every result matters. And then the third component of our business is in what we call Preanalytical Systems. And this is where we produce very specialized materials that are used in blood collection tubes. The reason these materials are important is we have to be able to stabilize the blood so it can be transported and tested. And so that's the three core elements of our diagnostics business.